Okay, implantation bleeding versus withdrawal bleeding. You had unprotected sex and you are bleeding now after you took an emergency contraceptive. Now, which one is it? Are you pregnant? We don't know. So these are some key things that you can look at to kind of determine what is happening. So if it is a withdrawal bleed from the pill, this can happen because it is disrupting your hormones. Sometimes this can cause some bleeding depending on which phase of the cycle you are in. If you took it more near your period or on your period, this is more likely to occur. So the withdrawal bleeding tends to occur about a few days to a week after taking it. It tends to be a bit heavier, moderate bleeding. It can look like a period, it can have cramps, it can have clots, and sometimes it is red and brown and tends to last for about a few days, up to, let's say, average is 5, and I've seen even 2 weeks of bleeding occur. Now, an implantation bleed tends to occur about 5 to 10 days after ovulation. It tends to be very light and sporadic. It can be pinky, red, or brown, and it lasts for like up to 2 days, maybe 3 max. And obviously both of those symptoms kind of coincide with each other. So again, that's why it's hard to tell which one it actually is. If you think you might be dealing with an implantation bleed, then you can take a test about 2 to 4 days after this point. If you think it's a withdrawal bleed, you can still do that just in case, or you can wait for that 2-week mark after the incident occurred, and then you can take your test. Now, some pregnancy tests say that they can work up to like earliest like 7 to 10 days after conception. Sometimes it can be a bit early. It really depends again. So, I mean, if you're wanting an accurate test, the generic wait is about 2 weeks. And this is basically just because you need enough HCG in your urine to be able to pick up on a test. And if it doesn't pick up, then you might have a false negative, where then you can just take another test a few days later if you think that might occur, but then you're taking multiple tests. They are cheaper to get on Amazon if you want cheaper tests. Now, if you did get a withdrawal bleed, this can be a sign that you are not pregnant and it did in fact push ovulation. This is not a 100% sign, so still you can test again. A lot of people do get a late period after this because ovulation is pushed and your period follows ovulation. If your ovulation is pushed, then your period is going to be late as well. There's a little recap about what we talked about. You can compare it to what you're experiencing and save it for later.